Hi everyone, I'm Jim Gray, the CEO of iRecover Treatment Centers and Behavioral Health Clinics. Welcome to our STEP series. I'm going to be breaking down the steps of Alcoholics Anonymous, talk about the iRecover program and how we do it, and tell you some of my own personal stories and suggestions. And when you're sitting in treatment and you're getting clean and sober and watching these videos, and you're starting to perhaps struggle with the action of a program, remember where you come from. Remember, you wanted to change your life. And of course, remember who phoned who. Hi everyone, I'm Jim Gray. I'd like to welcome you to our third video of this series. Now, the American Medical Association and most of the scientific community have recognized addiction and alcoholism as a disease since the mid-1950s. Many people believe it's a choice. You know, that the alcoholic chooses to drink or the drug addict chooses to use drugs. No, where I don't believe that. I don't think I had a choice. You know, I might have had a choice in the beginning, but once I took alcohol into my system, it set up this reaction that I no longer had a choice. I needed another drink at such a level that it's hard to explain, because the level was so deep that I didn't want to drink because I wanted to drink. I wanted to drink because of the effects it had on me and how it made me feel. So even if I didn't want to drink, I still needed one to get that feeling. Alcoholism is a chronic, progressive, and incurable disease that is characterized by the loss of control over an alcohol or drug. You know, scientists have decided that alcoholism is a disease, and a lot of them are pretty skeptical in the beginning, but they're not so much anymore. To be classified as a disease, the scientific community has to have a rigorous testing process in place. A disease must have a cause that may or may not be known. A disease must have specific symptoms or complaints from a patient. A disease must have specific signs that a doctor can discover by examining you. A disease must have a natural history that takes its course. A disease must have an established outcome. Well, with alcohol, it's going to kill you. So a disease that also implies that there may be a treatment. Alcoholism, therefore, qualifies as a disease. When you look at that criteria, and that's why the scientists have decided that it is a disease, because it fits that whole concept. Loss of control over alcohol and other sedative drugs is what the disease is. Well, you know, when it talks about the cause of alcoholism, all I can do is talk about my own. You know, and the cause, as far as I'm concerned, is that I had no ability to talk to people. I was very shy. So the alcohol gave me the ability to do stuff that I could not do without having some kind of stimulant. You know, alcohol has a lot of symptoms that everybody has. And there's been studies back in Yale in the 40s and the 50s, after studying thousands of alcoholics. The highlights of the system of what they found was, with early stages of drinking, people drank to relieve stress. Then they had blackouts and they'd forget they were drinking. And then they'd get repeated drunk driving charges and they couldn't figure out why. But the problem was their loss of control over alcohol and other drugs. And then it moves up to another stage called the middle stage, where it becomes family problems, job problems, money problems, legal problems, God knows I had enough of those, personal problems, that do things, and people do stuff. I did things that I would not normally do. And then it progresses into health problems, such as heart problems, liver problems. And then in the late stages of alcoholism, where you become more and more consumed with the alcohol, the course of the disease is progressively downhill. The patient gets worse. If you're in jail, you're lucky because chances are you're not going to die from it. But if you're out on the street drinking, chances are you can't stop and you will die. But alcohol is a funny thing. We can quit drinking today, and all of a sudden, all those problems, at least the health problems, stop, and you have the ability to do all the psychological problems. But if you're abstinent for a while, what happens is that, say you don't drink for 10 years and you go out drinking again after 10 years, you won't stop, or you won't start at where you stopped your consumption. You'll start as if you drank those 10 years. So all of a sudden, even if you weren't a laid down drunk when you initially stopped, if you're an alcoholic, when you get to that point 5 or 10 years down the road, you're going to drink so much alcohol that it's going to kill you, and there's nothing you can do about it. You're going to die. Well, according to the U.S. Federal statistics, 98% of untreated alcoholics will die from their disease. Not necessarily from cirrhosis of liver, which is what most of us think will happen, but from accidents. A lot of people die from their own vomit. They throw up, and their airways will get blocked, and they'll be sleeping on their back, and they'll die. Their loved ones will come in the morning, and there they are, all their functions let loose. What a mess. What a way to go for your loved ones to remember. I don't want to paint that picture, but maybe you shouldn't either. And 1% of the people are committed to mental institutions. 4% of alcoholics seek help, and they go to treatment centers. And the statistics are very poor for most alcoholics because they just refuse to go to treatment because they're going to do it themselves all the way to the grave. People say alcoholism runs in families. I don't know if that's quite true. I know my alcoholic father died. When I was 7 years old, my father died from alcoholism. And I know around the rooms of Alcoholics Anonymous, there's a lot of people who lost their fathers. So I guess there's some relationship to your father drank or your mother drank or whatever. But the truth is that I've got siblings and they don't drink. So how is that part of the genetics? I'm not so sure that that's a true statement. But maybe it is in your case. But I found out in Alcoholics Anonymous, who cares why I drank? The thing is, I had to learn what it was doing to me and what it was doing to my family and quit that and start over again. So you're here in one of my facilities, and what happened with me is 25 years ago, I got beat up enough that I started cleaning up. And I went through treatment, a day treatment center, and this fellow named Paul Riopel. And he put me through treatment. And when my son got into an accident 15 years later, and when I wanted to open treatment centers, I went and got Paul, he was still alive in those days, and got him to build this program that you're all going through. And the reason I know this works is because it worked for me, and it worked for thousands of others. And what you're going to learn here is the alcohol, the drugs aren't the problem. You're the problem, and how you look at life is the problem. We have a great outcome here. We get 60 to 70% recovery at iRecover treatment centers. And the reason we get that is because I believe it's because of our staff, it's because of how we present stuff. It's because we're going to make you work on you. I'm not interested in you coming back here. Now, if you go out and drink and you decide to come back, that's fine. My motivation is to get you clean and sober. Because part of this whole program, as you'll discover, is to help other people. And when you help other people, you stay sober. So as long as I can get you sober, it's going to help me. So if you want what I have, you have to do what I did. And this is all in this program here today that you're going to learn. You're going to teach you all kinds of stuff that you're going to have to look at yourself. Forget looking outside to see where the issues are. Look inside.